Hi, this is Dr. Jeanette. We're going to jump right in and talk about shockwave therapy. So it was actually established in the 1980s to treat kidney stones, but they discovered that it also helps to treat different orthopedic and musculoskeletal issues. It's a completely non-invasive treatment that helps to promote recovery and healing of acute as well as chronic soft tissue injuries, bone pain, as well as joint pain. Know that shockwave therapy does not produce any shocks to the body. Instead, it's actually using a very short energy wave that'll promote healing at a cellular level. And so there are many effects, and the first is that it reduces pain at the local level. There's also an increased circulation as well as metabolism, which will promote healing. There's a decrease of inflammation. It's going to help grow new blood cells, and at the end of the day, stimulate stem cells to promote regeneration. All of that will accelerate the healing. This effect is done by really stimulating at a metabolic level and enhancing blood circulation to regenerate the damaged tissues. In many instances, shockwave therapy has been really great where the human body has been able to heal itself on its own. Many benefits. First, it's completely non-invasive. There are no side effects. It accelerates the healing time. It's a great, quick treatment. And we'll talk about how long that is, as well as it's very affordable. Will it help me? And so shockwave therapy has been very well researched, and from a general perspective, there are many double-blind randomized control studies which show that there's a 75 to 95% success rate in numerous conditions. What are those conditions? This is not a complete list, but it ranges from treating plantar fasciitis, Achilles tendinopathy. It helps to treat trigger points, or what we call knots in these muscles where there's a chronic irritation there. Helps to break down scar tissue. It's great for what's called tennis elbow, jumper's knee, great for rotator cuff tendinopathies or tendonitis. It's great to release fascia, shin splints. It helps to treat a variety of shoulder issues. And at the end of the day, it can treat any tendinopathy or tendonitis that you'll find in the body. There's also great research that shows that it's helpful with frozen shoulder. And so how many treatments will you need? And that'll really depend on the tissue response and your injury. However, most patients will notice a change within the first 4 sessions. If it's a chronic issue, some patients may need 6 to 10 sessions, but most patients will feel a pain relief within the first sessions. How often will you need these treatments? It really depends on the tissue and the diagnosis, but at the end of the day, most patients will do 1 to 2 sessions per week. Are there any restrictions after this kind of treatment? And in many cases, the answer is no. Most often, we'll actually recommend that people be active, do some specific stretches, but if there's any limitations or restrictions, that'll be done on an individual basis and will be told to you during your treatment. Will it hurt? And the answer is no. There is a slight feeling of discomfort during the treatment, depending on the level of pain that you're already experiencing in that area. However, most patients do very well with the treatment, and it's really just a quick treatment. It's about 5 minutes, and the intensity can be varied depending on the person's tolerance. So on that note, if there's any questions that you may have regarding shockwave therapy or how it might be able to help you, then please reach out to us, whether calling us or sending us an email, and we'll be happy to answer any questions that you may have.